Repose Wedge is part of the Foot Care Solutions range and works by providing support to the lower limb, allowing for full offloading of the heel with the benefit of immersion and envelopment. Repose is indicated for the prevention of pressure ulcers for patients at very high risk and treatment of all categories of pressure ulcer when used as part of a package of care. Remove Repose from the tube and refit to form a pump. Connect the valve on the pump to the Repose valve. Push to fit. Begin inflating and continue until air can be heard escaping from the pump valve. Discontinue inflating and wait to hear an audible click. This signals the correct inflation pressure has been achieved. Disconnect the pump and cover the valve with the solid end of the Repose sealing cap. Check Repose regularly and top up within a period of no longer than 14 days using the pump supplied. Install Repose with the valve facing down and away from the patient. Secure in place with the integrated retaining straps. Repose Wedge can be used to give full offloading of the heel whilst a patient is led in bed. It can be used both for patients who are at any level of risk of pressure damage or for those with active heel pressure ulceration of any category, including unstageable and deep tissue injury. Ensure Repose Wedge is positioned with the largest air cell towards the foot end of the bed and allow space for the feet to hang over the end without touching the footboard. For additional comfort, drape a loose sheet over Repose, ensuring the sheet is tucked under the foot end of Repose Wedge to allow offloading of the heels. Do not tuck the sheet under the end of the mattress, as this will cause the sheet to hammock, reducing the effectiveness of Repose Wedge and increasing the risk of potential damage to the heels. With the patient off Repose, detach from the mattress. Insert the open end of the sealing cap into the Repose valve, allowing air to escape. Once deflated, with the cap still in place, roll up Repose, starting at the point furthest away from the valve, expelling any remaining air. Repeat this process as necessary. Fold and roll up and place inside the pump for safe storage. Rotate the outer tube until it clicks closed. Please see the recommended cleaning agents for Repose document for further information. Repose can be cleaned, decontaminated, and reused. If visible signs of dirt and contamination are present, Repose, including the cover, should be mechanically cleaned using detergent and water. In the absence of visible contamination, Repose should be mechanically cleaned using detergent and water weekly. Rinse with clean water and wipe down with a single-use non-abrasive cloth and thoroughly dry. For further information, please refer to the instructions for use.